minute, actually, and we will really start. I always like him to start first before I go next. And now, welcome. Welcome to Medical Mondays with Dr. O. We're here for another exciting night. I'm really excited about what we're going to discuss tonight because we have one of ours, a pediatrician, Dr. Teju Ogunrinde, who also dives into so many things. She takes to heart what scripture says that you should not put all your eggs in a bag, that you should diversify. And I hope that even though our topic tonight is not about that, that we will take that home also, because she has coupled medical care with holistic care. And without much ado, I'm going to have her complete her own introduction and hand over the baton to her. So, Dr. Ogunrinde, the floor is yours, and welcome.
Thank you. Thank you so much, Dr. O. It's really a pleasure to join you today. So we met by chance like about 4 weeks ago, and she was telling me about this program. And then, of course, like she always keeps her words. She called me, I had forgotten about the date, but then she called me and said, "You're on for today." So I am on for today. So thank you so much for joining me. I mean, for allowing me to join you today. As you said, I'm a pediatrician, but also I have, I started with obstetric and gynecology before I went into pediatrics. And that's why I had ventured into so many other things like, aesthetic medicine that I'm doing today. So, so now what we want to kind of go in today is about total wellness and medical spa. So, at the beginning of when we were just waiting to get on, I think Dr. O mentioned that somebody died, and the gentleman was saying like, how come people are dying and just dying just like that? I think in our community, we tend to take a lot of things for granted. Like we only kind of cater for other people instead of focusing and having a good self-care. So I want to use today's opportunity to kind of focus on that, to see what is total wellness. How does it affect our physical health, our mental health, our emotional health, spiritual health, and aesthetic medicine. So we'll start with the physical health. These are the pillars of total wellness. You see here in physical health, what do we mean by that? We wake up, we all kind of like after when we're young, we metabolize things, we just move just day to day, and we kind of go along with everything. But as we get older, we need to live purposefully, healthy. We need to think of how much time do we devote to our personal health, like physical exercise. What do we eat? What do we put into our body? How much sleep do we get? Are we doing a preventive care and all that? That's what is the major reason why people just kind of just you see them today and you don't see them tomorrow. I've spent so many years going on medical missions, and when we go on medical missions, what we find out mostly was, people are not overweight mostly in Nigeria, especially in the rural areas, because they are busy going to the market, they're going to the farm, they're doing all that, they're doing their physical exercise. But there are other issues of stress life, like how to maintain their daily intake and provide for their family that stresses them out. They don't get enough sleep. There is no one to talk to. So they just kind of handle things all by themselves. So that leads to a lot of, changes in your cell availability, in how you kind of maintain your blood pressure, And then if you now work all day, you go back home in the night, you eat a bar with all this major stuff, it sits in your body and then you don't digest it. And then, there's no metabolic kind of job going on at night. So you end up gaining the weight and then you end up with obesity. And then what else comes with that? Diabetes. We now start to think of so many other diseases that affect oneself. So the other side of total wellness is the mental and emotional health. Mental health that we are talking about is not the mental disease. It's not that. It's more of like your mental state, how you cope with day-to-day stress, how you manage stress. When somebody tells you something, do you hold on to it, or do you kind of internalize it and let it go on to eat you up all day long? And when that is going on, it's increasing your cortisol level, it's increasing your blood pressure, it's stimulating so many agents in your body that causes, risk of cancer. That's why some of the studies that they showed with breast cancer, that people that are much more exposed to stress life, fat, and older and over 40 are all at risk. So that's one of the things I want us to focus on. As we all have people around us that are going through this motion in life, not even taking a break, just going from one day to day, kind of doing that. So those are the things that we all need to put aside, our mental state, physical state, nutritional state, are we sleeping well? So when we talk about preventive and functional medicine, means going to the doctor. I know some people have health insurance, but some people don't have health insurance, but majority of us in the US have health insurance. But how many of us go to the doctor to go for your regular checkup? That's another thing. So we pay for this premium, but then when it's time to go for checkup, so, well, nothing is wrong. I don't feel anything. Blood pressure, you don't feel anything unless it's really very high. That's when you start to have headaches. And sometimes it's already too late at that time. So when they say, okay, you go to the doctor, and I mean, being in pediatrics, we do a lot of preventive medicine. And that's why, when you now become an adult, you have to advocate for yourself, because adult medicine is also different, because they expect you to know what's wrong with you and tell them what's wrong with you. And then they refer you to places and get things done. So this is why it's important when you go to the doctor, have your questions written out. It's like, okay, this is what I'm going through. This is what I'm doing. What else do I need? Have I gotten all my screens for this year? Your mammogram, did you get my results? Some people will do test result, you don't get any result back. If they didn't call you back, you need to call them. Sometimes if they don't call you back, it's normal, but sometimes they miss it. So it's also a responsibility to call and say, okay, did you get my results? That kind of thing. So that's part of preventive medicine, getting screened. Men need to get their screen done, like the PSA, you need to do that. Of course, colon screen, from 40 years of age, you need to be able to say, okay, you get your colonoscopy, all that. Those are categorized under preventive medicine. So now we come to spiritual wellness. I don't think that is lacking in our culture. So we are all, a lot of us are prayer warriors. We know how to meditate, we know how to do that. But, sometimes we do all this, we focus so much on the spiritual wellness that, we don't combine it with the modern medicine to say, okay, I believe. When you pray and you believe it at the foot of God, at the base of the altar, you know that your prayer is answered. You have the belief, you have the faith. But then you're also supposed to work and just, you can't just sit down and not do your part. So follow through and having the attitude of gratitude. When you have that attitude of gratitude, you have peace within. You have peace within, and when you forgive people, how can you say lord, say the Lord's prayer without forgiving people that have offended you? There is a cause. You should not say that verse if somebody offended you and you are now staying at night and praying. You should think about that when you said, as I forgive others. So please, just keep conscious of that as you do that, because that gives you peace, that gives you peace of mind when you're able to kind of relax. So, and then social wellness, as we get older and we have these children that we go so far, we dedicate all our life just taking care of them. They get older and they have to move to their own, they move on. They have their own family to take care of. Now is you and your partner in the house. You and your husband, or you and your partner in the house. If you guys were never getting along before, you don't talk, it would just be a routine in the house, and the day would just be longer and longer every day. And do you have any friends outside the main support? Friends in church, friends outside church? Do you have people that you can just say, well, call and say, well, let's just, have tea. Let's just go out. Let's go to the beach. Let's go somewhere. Just let's read together. Let's take a walk together. If did you get your mammogram today? Oh, I'm doing something tomorrow. Can you come to my house? Let's fellowship together. Those are social wellness that help to do a lot of that, lets you take a little bit of the stress away from what you're going through. We talk about so many other things, occupational, like just, when you're working, when you're working, so, and you have networking. A teamwork is always better than just by you. And that's part of, when you are successful in what you do, it gives you also confidence in what you need to achieve more and how to spend that money with your family. You understand? So financial wellness is part of total wellness, because people will say, oh, I'm not so interested in money. But if you don't have money, you can't help other people. You can't even help yourself. So we need to factor all that into it. So, and your environment, how are you doing are you living in a safe community, in harmony with others, or are you fighting with everybody? If you go somewhere and say, oh, you better don't talk to her. If you talk to her, she'll carry all your business to so place. So people will be careful when they come around you. So, I mean, and when you see all these things that I've mentioned together, nobody is perfect. But when you kind of factor in all these little things in different aspects, it gives you a total holistic way of looking at life. It gives you peace of mind. Your blood pressure is down. You're able to sleep better. You go to the doctor, you have a good conversation. They take your blood test, they call you back. Your cholesterol is fine. Everything is fine. Life goes on, right? Okay. So, but, then we talk about aesthetic and self-image wellness. Okay, you've done the best you could, but then when you have children, you have all these, excess baggage around your stomach, right? We're aging. We can't come back to aging. Some of us are doing well. We're exercising already. Skin is firm. Some of us have good genetic kind of genes, and we have firm face. Look at doctor. Oh, you can't even tell she's okay.
I know. She
So
cheating. I know.
so some people have, good genes already, but some people don't. And so if you postpartum, you have the baby, like let's say you have twins, you have triplets, there is no way your skin, your abdominal wall will be as perfect as me that I have only one child, or somebody that didn't have any. So, but that does not mean that there is something wrong with it. But as a person, when you look in the mirror, sometimes you always wish, oh, this is who I used to be, because your mind is still functioning, your mind is still active. So you still remember yourself as this, beautiful person. But then you're looking at this particular thing and gives you a little bit of, and then you're thinking, oh, if I try to do something about it, they might think, I'm kind of vain. So you're thinking of, because of that little bit of what everybody has thought about aesthetic medicine, you kind of think about maybe I shouldn't do anything, and then you live with the shame. But then, maybe you don't care. Maybe it's just a little scar that you got when you were playing when you were little, and then you have that scar somewhere and you don't like it. But then there are other choices of what you could do now. Unless you talk to someone that you feel safe about, you may not know that, okay, you can get rid of it. People, when they were doing in when in I know in my family when we were young, there's another family that they used to put marks on. My grandmother had the marks on her face, but in my family, as the royal family, you cannot put any line on any of the kids' face. So, but when people were older, people that have the lines on their face want to take those lines off. So, and there are choices now. A lot of people are doing that. I got tattoo when I was little because people I got back home, but I still have the mark on me, but I have a choice now to be able to take it out if I want to. Do you understand? So those are self-awareness that creates self-image, aesthetic issues that could affect your self-image, that choices are now available in order to be able to take care of it. So when you look at it, so everything I'm going to be talking about will be relative to what I just kind of characterized under the pillars of total wellness. So for people that wonder what blood pressure, normal blood pressure is all about, I put it here only because a lot of people, these are what they call a silent disease. So I wanted to say, like, in case you buy they have those monitors at Costco or any of the CVS. You can always do your blood pressure in the morning and at night before you go to bed. If you want to take, because sometimes when you go to the doctor, your blood pressure is normal. But then once in a while, when you're so stressed about something, you feel your head throbbing on one side of your head and stuff. You don't know why you're having headaches and all that. It may be because you have stress-induced high blood pressure, not necessarily, there all the time. But those are also relative. If when you're stressed, your baseline blood pressure may be fine, but if you're stressed, your baseline more than 24 hours is going higher than what is normal. That he's doing a little bit of chronic inflammation on your blood vessels, the end organs like the kidneys, your heart, all those things. So I want you guys to at least do yourself a favor, just have your blood pressure kit. The automatic one is always okay, so you don't have to figure out how to measure it. So these are the parameters that you should follow. If it's falling below 120/80, you're okay. So if it's anything 130, you should go to the doctor and let them recheck it for you. Okay. So, and so when we talk about role of medical spa, so what is aesthetic? So we went through that. So it's just beauty rooted in cultural, spiritual, or personal values. And the reason I put cultural there is that aesthetic didn't just start now. It started way long time ago, because we all know in our culture, you can think back of how even the marks we put on the face, the way we dress, the way we use mark, like even in some cultures, they still do that in the in I think Eastern Africa, where they will still put the marks on their face. That's part of you know aesthetic beauty, something to make you feel spiritually good, or like to improve your personal value. That is, and that is what aesthetic is all about. So when we now combine the function of medicine, how we treat some other physical ailments in our body, like the wrinkles, the excess skin, the scar, and all that, when we combine that with the self-awareness of how it makes us feel, that's what they call the medical spa. So we're combining both, like it's making us feel good, but also treating a medical condition within us. These are the purpose and meaning that were associated with traditional African aesthetics and the modern aesthetics. You could see in those days, it's part of identity. Like, if you're a certain tribe, you you kind of dress in a certain way to make you look in a certain way. And then, but modern medicine, we just want to look better. We want to feel better, look better, and just makes us feel better. Like if I'm 62 now, if I see if I go, when I go for tennis, people say, oh, they put me in the category of the 40 and over. So that's okay with me. But if I'm 40 and I'm looking 60, I'm gonna be defending myself all the time. Like, listen, I'm not 60, oh, I'm still 40. Please to be in my own lane kind of thing. So, but as we go along and we evolve from using just the regular herbs, the clays and all that, and then we have different devices, different like fillers and different things like Botox to kind of make things look better. So things are different now and it's evolving. It's not just like one ends from the other. But we are also getting into new way of how people are thinking. We all want to use natural products. So even now, we're still trying to combine the old way of doing beauty aesthetics, with modern aesthetics, but we have more advanced tools that we can use that are much, much better, like lasers and that are more skin specific to our melanin skin. It's what I would call it. Okay, so the difference here is just what I just introduced to you, like the traditional African aesthetics. They emphasize on the identity and the belonging. Meanwhile, aesthetics, we just want to make sure that people look better and you feel better within your community. And it's and I will use some of the diseases that we have to kind of define this because when you think of hyperpigmentation and melasma, so they have some people that very common in dark skin actually. You see like a dark spot patch on the face. And you kind of wonder, were they bleaching or like what's wrong with their face? But it's a difference between the people that are bleaching. The issue is sometimes they may start with using the bleaching cream to treat the melasma, which is one of the treatments for the melasma. But then if you use it for too long, then it becomes a problem where it causes a chronosis, where it makes your skin kind of thick and dark and green, which I know they banned some of those medicine in Africa now, but if you still see people doing it, they are still using illegal kind of combination of creams to like bleach skin, which I think that is probably why one would kind of say, oh, that's aesthetic medicine, or I don't want to do that. But aesthetic medicine is so way beyond that. So there are better ways to treat acne, to treat wrinkles, and even like postpartum stretch marks, all that. That is treatable now with using the newer technologies that we have now. And also, when you have swelling of the feet, a lot of times it's because of the lymphatic drainage. Like this, there is a little bit when there's a blockage. All the things that happen on your skin, around the area, on your legs, it drain through the lymphatic channels, through your and into your veins around the groin. But sometimes there is a lot of backup pressure because some people it may be due to the hypertension or just some pressure because of some issues in the abdomen that is causing backflow of pressure. So people end up with lymphedema or they just have swelling. But we have machine now that can help with the lymphatic drainage by doing the improving the blood flow in the legs and all that instead of just doing the socks. You can increase the blood flow and that will help you to increase the lymphatic drainage. The other issue, like, we talk about the mental health boost when you improve your self-image. I think that's no brainer. So we all know that, if you look good, when you wake up, you're not doing it for anybody. You have to be able to do that for yourself to say, I feel good within me. The other thing that is also more medical that is, treatable is the perimenopausal symptoms. Um, and, as you get over 40 or you know, towards the menopause stage, a lot of, women, sometimes you end up, getting higher testosterone. So which results into the like excess hair around your face, places you don't want the hair. I'm sorry, let me see. It's not her. Okay. So places that you don't want the hair. So those are treatable by laser. So, and if you kind of consult with your aesthetic doctor earlier, you can get that done. But because by the time you get to an older age and you have white hair all over that place, the laser doesn't see the white hair anymore. So you end up having to pluck your hair every single day. So um, also, sexual discomfort, we can talk about that. That you can also talk about that with your OB doctor. When you go to your gynecologist, you can talk about what's going on. A lot of marriages break up because, they're not having sex in the house, they're not communicating, not because the woman doesn't want to, but because it's too painful. And, some of my friends would tell me, okay, what do you do for dryness? What do you do for that? But there are natural products that can be used, that you can make naturally. I do make one. So some of these things, when I go to school, I go with purpose of, what is it that is needed? What can be useful for me compared to, that I can use for myself and be able to use for my family. That's how I focus on what I develop in most of the things I do. So, but there are so many areas of, perimenopausal symptoms that one can really, um, you know, deal with in terms of aesthetic medicine, like, bladder incontinence, when you smile, all those things that people are going through that. And, those are things you can talk to your doctor or esthetician about, aesthetic doctor, not esthetician that just do massage for you. That's a difference in the two. So let's see here. All right, we talk about the barriers. I mean, like, we talk about, I've mentioned this along the line about, what could limit someone from getting access to this aesthetic care. You know, people will look at you and say, oh, she's just vain, or she's not that, she's not tummy talk. There's so many choices of tummy talk. Tummy talk when, it's when people die on the counter, on the table, on the surgical table. Everybody hears about, somebody's wife went to France, got killed because of so. But there's so many non-invasive choices that we do these days that are available. As we go on with technology, they have the True Sculpt, which is the heat. The heat eats the fat and, melts the, so that and it's FDA approved to reduce about 24-25% of the localized fat of where you put it. There's Cool Sculpt. So, and I think those are much safer in any day of age because, it's non-invasive. You don't have to stay at home to do anything. You move on with your life and you continue to exercise regularly to maintain what you need to do. But you have to go to a place where you feel comfortable. And that's the usual thing about our community. Other people do, other cultures do it. But I think for us, because of how we are brought up, because of how, we need to like keep to ourselves, protect our emotion. I think, it's okay to reach out to look out for African doctor, or even talk to your own personal doctor and see whether they can give you a recommendation to someone that does this kind of, treatment for aesthetic medicine. Of course, it's not cheap. I know that, but a lot of practices have like payment plan that can do it, so you don't have to pay so much money upfront. And believe me, they're much, much less expensive than doing a surgical procedure. So they are not everywhere, and some places have different machines than the others. So you really have to know that you go to the right place when you do that. So Now we talk about the bridge of, kind of how do we bridge, like the modern aesthetic and the new aesthetics. So I've talked about how, there is a rise in people doing clean medicine, holistic services, like I was talking about the melasma, the skin care. We have the richest resources in Africa: cocoa butter, shea butter, so many things like that. So oils, batana oil, all that. We have all that for your hair growth, for your skin care. So many things we can put together. This product that you see here, this is that's some natural alpha butane, which are like natural esters that you can put um, in butters that can remove dark spots from your skin, help with the stretch mark because of the vitamin E and all that. So these are the way we are bridging the gap because, but you have to go to the right place at the same time, is what I mean. So, because there's so many things on the internet, people will say this does this and all that. So you need to make sure you go to a trusted location to make sure you can incorporate a nice, natural products like moringa, all those, we have all that natural product into the product that you're using. But most of the time, if you need help, the internet is also good resources to look for the ingredients, because you should always look at the ingredients of the product you're buying, because a lot of stuff they may be mixed together that are not safe for your skin. So it's important to look at that and just, bring it to the doctor and say, I'm using this. Is it safe for me to use? That's another way of looking at it. These are I put together some of, things we could do generally, like, people like, when we want to say, well, I like to use herbs. Okay, yes, it's okay because all medicine they are developed, most of the medicine are developed from herbs, even though now we do synthetic and genetic testing and all that. But when in those days, that is how most of the medicine are developed, using the plant resources. So there are certain things that are good for something, like licorice roots, kojic acid. Those are good, they're natural products. If they're in your shea butter, they're in your mango butter, they can help with the darker spots of the skin. Bitter leaf, when, it says it reduce blood glucose, and some of these things I kind of check to see, what's the dose of it. It's not something that you want to take that and just be drinking that all the time. Some of these things have to be produced really effectively, because I know people go to Nigeria and be drinking a lot of, bitter leaf juices. If you drink more than half a glass of bitter leaf, depending on how you produce it, that may lower your blood glucose to like cause hypoglycemia. So like, and that's usually the issue we have with the dosing schedule when we do agbo and all these other things. I know they do a lot of zobo tea and all that in Nigeria, but everything in moderation is always good. So we have to make sure we take that into consideration. Um, these are when you look at the traditional remedies, I put that in there that are backed by science. Those are the things that, they've already looked into. I checked some of these resources on the NIH book. And portion control is one of the major ones that I have, when I was talking about nutrition, in terms of keeping our healthy goals. Portion control, like balancing our sugar, like complex carbohydrates to protein and fat, filling half of your plate with more of the vegetables. And protein is good, like a large amount of meat and and vegetable. And then you have a little starch. Because a lot of people will eat a big bowl of eba and put a little vegetable and one meat. It should be reversed. Your starch should be the size when you put the size of your palm, that small. If you have big hand, if you're not that big and you have big hand, you should be careful. So, but it should be the size of your palm, that much size. It shouldn't be more than that. But your vegetable can be twice or three times that. And if you are overweight and you're trying to lose weight and you want to walk in naturally, those are the ways you can do that by increasing your vegetable intake so it makes you feel full. But you have to drink a glass of water before you eat. So it reduces your craving for more food. So that way, by the time you get to a certain stage, it tells your brain that you're full. And and then, of course, exercise. We've talked about exercise as well to combine with that portion control and the food groups, to make a holistic kind of weight loss journey. 1 hour a day is your self time. So these are the solutions of what I've talked about. I don't want to take too much time. Like tailoring, making sure you go to the right person to do the treatment for you if you have to do that, because when they were making most of the machines for medical spa, most of them were geared towards skin type 1 to 3 or one at the most 4, which are the white people up to like a little bit of Latinos. But now we have more machines in the market. So when you want to do laser hair remover or do anything like that, you have to make sure you go to a company that has a good machine that covers your skin type. We're usually in the group of 5 to 6. Okay, we talk about self-advocate, like when you go to the doctor. So to make sure that you ask for your test results, you tell them exactly, well, I think I'm due for another one of this test. I did my colonoscopy, 5 years ago. But, if you feel like you're having like constipation, you're having occasional blood in your stool, don't wait for them because they told you to come 10 years more. You tell them, I need another one. I'm having problem. If you have symptom, they will do the test. If you don't have any symptom and you just ask for the test, they will tell you to come back in another 10 years. So you need to tell them, I'm having symptoms, I'm having pain, I need the test done. So those are and different ways of advocating for yourself when you go to the doctor. So when you go to, I know sometimes we all feel comfortable when you go to a doctor's office, you see someone that looks like you, it makes you feel safe. But sometimes it's not always so. But to me, I think it's a good thing when we have doctors like us around, we can refer each other, can let them know where they can find us so that they feel comfortable talking to us as well. So, but that's part of networking. That's why we are doing all this community work so that we all can care for each other. We can refer to each other. We can know that, if someone needs help, they know where to find the help. We have organizations like Cancer Awareness Organization, people that would give out free mammograms. If you belong to different groups, if you don't talk about it, your friend may not know about it. If you go to church and someone needs help, if they don't know where to get help, they're just going to keep quiet. And so it's good to say something so that way, if someone needs help, they can actually reach out to you. So I wanted to show you some of the things I do in my office. So this is what they call hotspot. So hotspot is like it's a feminine product, like a clean gel. Like if you have dryness, it's rich in hyaluronic acid and it's mainly with aloe and just natural with a balanced pH. Because a lot of people, when they just buy anything over the counter, if you don't have a balanced pH, you can cause infection when you're using some of these products over the counter. So it has to be a balanced pH. So you need to know exactly what you're looking for. Some of these, and then this is another patient with, like I said, we do hair hair restoration as well. So, and I don't know whether any of you have had any experience with hair loss. Because of the testosterone increase in our system around, menopause or so, sometimes you can have that central hair loss like men, but it's very distressing for a woman to have hair loss. You have patch, at the middle of your hair. So they pay a whole lot. And if you don't go to the right person, they promise you all these and they take all your money. So you have to go to the right provider to make sure they're honest, they know what they're doing, they're passionate about what they're doing to help you. These are, this when you see these other pictures of the abdomen, this is what is done by TrueSculpt, which is I call it TrueSculpt, like heat burning for the fat. These are not overweight people. So, I mean, you could see the difference. I mean, if it bothers her to that much, she wants it done, and that made her feel better. So the darker person that had the underwear on, so she had 3 kids. She said, Doctor, oh, I just, I've tried so much. I'm active. I'm doing all I can, but I can't get rid of this lower part. So we just did it at the lower part. And you could see that 3 months later, she felt better. I said, I feel so much better about it. I can wear my clothes without feeling like, I have to be putting the Spanx all the time. On the extreme side is what I need you to look at. So you could see the skin tightening in the lower one with the gray underwear. This is someone that carried twins. All the kids are grown. Now she's left with this. And she's an active person, does exercise like 2 hours a day, but still has the abdomen and still has the skin like that. So, to me, when you want to baby and she can swim, you want to go to the beach, you want to do all that. There is nothing wrong with taking care of yourself to make you feel better. So this is not vanity. This is just taking good care of yourself. Do you understand? So, and that is why it's important for us to be aware of what's going on. Especially like the one on the neck. It's like if you lose weight or like you just get into that older age, maybe you've never been that big, but then now because you're older, the collagen under your skin is now so thin. There's some non-surgical without even Botox. This picture you see about the neck on top is without Botox. We have a machine that helps. It's also like a heat, like RF heat. It helps to heat up the skin and just kind of stimulate your collagen, so you naturally build your own collagen back to thicken the skin. So those are the things that are available in the market, but unless you know about it, you don't know. And that's just it. So these are my group of people. This is Dr. Sanon. She's also an internist. She's based in Upper Marlboro. And this is our esthetician, Doreen. And this is Tayo. She's one of our um, assistants there as well. So we did an Elevate Day over the weekend. This is where we got this picture. We had so much fun. So in summary, my goal is that we think of um, wellness as being holistic, as being total, as being about everything, about medical, about our health, or about conscious and about spiritual being, just being able to promote our own self to others and around us. And bring your family, bring your friends along to make sure they're doing the right thing by themselves as well. Because when you don't, you're going to be part of their suffering journey. So when you know someone has not gotten their their mammogram, check on them. When was the last time you got a mammogram? Did you get a massage? Massage is not a luxury. It's a relaxing moment. It helps you decompress. You kind of, you kind of think about something else when somebody else is stretching your legs, doing all that. It should be something that we give ourselves at least once a month. So I know sometimes we don't have the time, but you make the time for what you want to do. So that's the goal of this. If you don't get anything from me today, I want you to take that moment for yourself. We do offer free virtual consults. If you This is my website. We do offer virtual consult. If anybody is interested in joining us or seeing us, of course, just mention Dr. O, so we'll be able to like throw in something there as discount. I can work with anyone, so it will be okay to for our office. And this is in summary of what I think today is all about. So, like I said, while traditional African aesthetic were too rooted in community, meaning, and nature, today's aesthetic practices focus on individuals' choice enhancement, and innovation. So it's the deep human desire for beauty, identity, and self-expression remains constant, though. Just the way we express it in terms of how we get what we get. Okay, so I know, so in when Dr. opens the floor, I want when you want to relate to your questions and all that, you could tell me which beauty traditions from your culture still influence you today in the way you do your own beauty checkups or beauty, like your own mindset generally. So that's it. Thank you.
Thank you so much. Wow. Thank you.
Yeah.
This is very important. And one would wonder, why are we talking about this? Because it's important to health. When you don't feel like you look good, when you feel like something is lacking or anything like that, it creates anxiety. That's mental health. Then it can lead to depression. That's mental health. It can increase blood pressure. You talked about that earlier, and I'm going to capitalize more on it. But if you please, I would like this information, if you can, transferred into the chat box so
Okay.
that people can easily click on it
Okay.
and go straight to the website. Yeah, you can end this like, yeah, fantastic. They can
Okay.
click on it and go straight to the website. Sometimes they do that, or be able to, just take, pictures and
So I
all of
can
that.
end this slide now, right? Stop
Yes,
sharing.
you can
Okay.
hand the slide. Thank
Okay.
you so much.
You're welcome.
So I have question or, some comments. If you have questions, by the way, if you're new to Medical Mondays with Dr. O, you can raise your hand to ask it. You get, to ask your questions first if you raise your hand. Or you can put it in the chat box and I'll read it out. They'll be answered. But I want to make a comment. High blood pressure or normal blood pressure. I'm so glad you talked to us about, getting annual physical exams done, what normal blood pressure should be. Um, we've been talking about normal blood pressure being 120 over 80, but you know that recently the standards changed.
Yeah.
It is now 120 over 70, maximum normal blood pressure. If you see the slide that Dr. Ogunrinde put up if you remember it rather, that she put up when she was doing her talk tonight, it had normal on one side, minimum on one side, and maximum on the other side. And on this side that shows maximum blood pressure 120 over 80, the minimal blood pressure is 100 over 65. So when blood pressure gets to 121 over 81 minimally or 129 over 84 maximally, then that's high blood pressure. The blood pressure is getting high already. When it gets to minimal 130 over 85 or maximum 139 over 89, that is pre-hypertension. And then when you get to the 140, over, I-80s or 90, that's high blood pressure. Please, I want us to note that. It is very important. Do you know that this morning I lost a cousin in Nigeria, high blood pressure, had a stroke, and didn't even make it to the hospital? That was something very preventable, something that just taking blood pressure medication or changing lifestyle, if, lifestyle was what caused it, could have reversed it and he wouldn't have left this earth at the young age of 65. He would have been 66 next month. Please, let's pay attention to our health. And then when it comes to how we look, it's very important also. So thank you so much. I love this, that you've put this in the chat box for us.
Mhm.
Thank you.
You're welcome.
So that being said, I'm going to switch to questions and answers. First question, Dr. Alu asked, how do men benefit from your program? That's a good one. Because yes, I saw all these females, but men too have flabby tummy, you know.
Yes, definitely. And I am so sorry I mentioned only women, but this is for men and women. So the abdomen also, we do the true sculpt for the abdomen. Um, Actually, for the face as well, facial hair. A lot of men, when they shave, they have a lot of hair bumps at the back of their head. So, and then also along the beard, if you are prone to that, using a laser hair remover can also help to reduce those bumps. So those are ways that we can help men benefit with that. We do weight loss management. Of course, men also can do that because if your weight is over a certain BMI, if your insurance is not, some insurance are covering the Wegovy now. So if your insurance is not covering it, we do offer that because we don't take any insurance with the medical spa. But if your insurance is covering it, that would be another choice in order to do the weight loss management. But we can do the skin tightening after you do the weight loss management to help as well. All this program is applicable to both men and women.
Thank you. When you said you can do tummy tuck without surgery, I'm
Mhm,
like, I want to see how that works. What do you use? I saw the difference in the abdominal girth,
mhm.
but what do you use to,
It's called a true sculpt. It's a true that it's the radio frequency heat. So it does go through the skin and is fat apostasis. So it kills the fat cells. So when it kills the fat cells, it then drains through your lymphatic system to go away. So that's how it reduces the girth. That's it, because that's basically what you do when you do tummy tuck. You take out the fat and then you tuck the skin there. So, but here it's not 100% as the surgical aspect of it, but also you don't go through the downtime of having a surgery and you don't go through the risk of having the surgery. So the RF heat helps to tighten the skin, but also kills the fat cells. And the True Sculpt is one of the, I think a lot of people hear about Cool Spot a whole lot, but True Sculpt is actually FDA approved to reduce the fat within 3 months with just one session of 15 minutes by 24%
wow,
of from the treated area.
wow. So I have another question before
Sign me up.
Ma,
Okay.
you have a question, Ma?
No, she got it.
Okay. Mhm,
So I have another question
mhm,
um, about hypopigmentation
mhm,
that is not vitiligo.
mhm.
Loss of melanin from the gum, spots on the face and chest.
Hypopigmentation that is not vitiligo.
That was the cause of it. The hypopigmentation is not vitiligo.
Mhm.
The question says, but is this loss of melanin from the gum and face and chest?
Okay, so if there is loss of melanin, that is vitiligo. It's that. So, but there are other hypopigmented area. The melanin is there, is just not coming to the top. So there are different choices that causes of that. Like you could have um pityriasis rosea. So they have different light spots. It could be fungal. It could be eczema because eczema spots will cause lightening of the skin. And usually those are temporary, they're temporary kind of skin lightening. A lot of them, you can treat them with topical steroids and moisture. That goes away by itself, once you treat it, or you can leave it alone for a little bit longer. But that's different. Vitiligo is total loss of the pigments. So you can't get that back, unless you bleach the rest of the skin to even it out.
Mm.
But most time is because you have to differentiate whether it's more of what they call some people will call it sunspots. Is because of the exposure to you can have lots of the melanin like not responding to coming up in order to create the melanin protection, which is when the melanocytes come over to the top is when they change the color of the skin to darker areas. But if they're not functioning properly, they get light. You just only have light spots. And those you can treat that with topical steroids. Eczema would be another source of it, or pityriasis album. They're just light spots. They're not vitiligo. But those are treated where you can work with a dermatologist on that.
Fantastic. Thank you. Dr. Lola is asking if you can repost the blood pressure chart.
Yeah.
And Auntie Tower, kindly unmute, ma. And welcome, ma. Fantastic. Welcome.
Good evening, everyone.
Good evening.
Thank you, the presenter. I can't remember. I think Dr. Ogunrinde, if I'm right.
Yes.
Thank you for the job well done. You just mentioned about the vitiligo and the lightening of the skin. What's the difference between that and the age spots?
The age spots. I'm
Those
trying
are
to remember.
hyperpigment. The
Age spots
hyperpigmented.
are like
they are
darker
light.
spots.
Oh, okay. Yeah, I've seen those too. Yeah.
So the age spot, the one that is like lighter on the skin. If it's not vitiligo, they're just loss of the skin because of the stretch of there's no collagen and they're stretching. I'm thinking that's what you're talking about, right?
This one has scattered. It's just one spot here lighter, one spot over there lighter, and they are age spots.
Oh, yeah, there's still okay. Sometimes, I think I probably know what you're talking about. There's still that patch of loss of melanocyte or melanocytes in those areas. And sometimes that could be because of medications. When you're using medications, it could be age because the skin is stretching. It's like it's almost like it's carrying under. It's actually not like there's a skin on top of it. So some of the skin kind of stretch out and exposes the subcutaneous area. That's why you see the lighter spots.
Thank you.
So that is different from vitiligo. And, if you're taking some blood pressure medication, also that could cause that to increase as well.
Okay, thank you. Then hyperpigmentation of our elbows, especially those of us from Africa, and also the knees, in front of the knees. How do you get rid of those?
I think, a lot of times, if that's certain, other than using bleaching cream, I mentioned some natural bleaching, something that one can mix with shea butter and all that. But if you do turmeric is pretty good. So you can use turmeric paste, but you have to get an original turmeric to make sure you can use that. That is also good in helping the darker spots around your elbow and the knee. You can make it like a scrub and use it like a few times a week.
Thank you very much. I appreciate you.
You're welcome.
Thank you,
Dr. O.
Yes, ma.
Auntie Tawa, òyìnbó yín ti ń pọ̀ jù o. All these big words.
A ṣẹ̀ṣẹ̀ jáde in school ni.
Grammar. Okay. Dr. Zugu, kindly unmute. Thank you.
Just a second, please.
Yeah, you're on.
Yeah. Teju, thank you so much for your presentation. And thank you for underscoring the issue with hypertension.
Yeah, Dr. Zugu is a cardiologist. Okay. You know what? If you didn't hear anything there,
he heard that one.
Yeah, there are a couple of the things you mentioned that you need to highlight too. The situation where you go to a doctor's office and your pressure is good. That's the condition actually we call masked hypertension.
Mhm.
You know, some people they go to a doctor's office and they are still good in doctor's office and pressure is really good.
Mhm.
But then when they go home under situations, their pressure really runs really high. And so you don't really pick up that they have high blood pressure unless they really are monitoring it at home.
Mhm.
And the risks to the heart, the brain, the every organ is the same. You know, and really underscoring why it's important to monitor the blood pressure, you know, twice a day, you know, and in different locations at your job, at different places.
Mhm.
And really pay attention to it because it's really, if it's running high, you need to have it treated and at least be on medication that can protect the organ from these surges of high blood pressure.
Mhm.
The idea of saying it's not your portion is not a solution to treating hypertension.
Yep.
And the thing to say that the blood pressure has, you know, you get a medication and after 1 month say it's gone, it's not, you know, it's not gone. You have to really manage it, monitor it regularly, diet, exercise, whatever needs to be done. And if blood pressure runs in the family, yeah, you likely will have it. If you're under stress, you likely have that. You know, and the new guideline with 120/70, it doesn't matter if you're old, okay? You know, really the idea of that, oh, because I'm old, my pressure should be 160 and it's good for me is not appropriate
Mhm.
because your organs are being damaged on that. You know, and so it's really important that you get a machine and be checking it and really work with your doctors and really have it under good control. Thank you.
Yep. You're welcome.
Wow. Thank
Thank
you
you.
so much.
Yeah.
Thank you. Please, let's take heed. High blood pressure is causing a lot of havoc,
Yeah.
both here and back home.
Yeah.
Thank you, Dr. Zugu. And Dr. Zugu has a HTPTC heart disease prevention and training centers in Enugu, and Oshodi, Lagos. I did the medical missions at Oshodi at the HTPTC there, not too long ago. So thank you for all you're doing here and there. We
We thank
appreciate it.
God. We thank God for that. And again, you can actually register and use the HDPTC app to monitor your blood pressure. You're checking it every day and submitting and taking a record of it and really taking that to your doctor and they can adjust your medicines to manage it. We have more patients from Mozambique registering and using that app than Nigerians. And we have more pressure issues in Nigeria.
Nigeria.
Please help yourself.
Can you put that in the chat box, how to access that app for people to
Sure,
monitor their blood pressure, please?
sure. I'm in my phone and I,
Uh,
I will
And,
send you
and I
something.
know you're still at work also.
Yes, yes. Okay, sure.
You
No
can.
problem.
Thank
I'll
you.
do that. Okay, sure.
Appreciate you.
Yeah.
Thanks. Opeyemi Adewale, kindly unmute. Thank you.
Yeah, good evening, Dr. Ho. Good evening, everyone.
Evening. Welcome. Been a while.
Yeah, it's been a while. Thank you very much. I just tonight let me skip the sleep.
Oh, all the way from
Because
London. Is in
wow.
is
London.
is
So it's definitely past midnight now, right? Around 1 a.m.
yeah. I would like to make a comment and also a question regarding the concept of holistic health. And because most of the time, thank you, Dr. Ogunrinde, for the presentation. And I've observed from time to time that when people actually talk about the holistic health, the spiritual aspect is virtually not all the time inclusive anyway, but they talk about the physical, the emotional, the mental, and the like. The What I just want to clarify with the spiritual aspect is the fact that what is your perspective with respect to spiritual aspect and how deep it is in holistic health? Because the reason I'm asking this, it may be a controversial issue, knowing that most of the people on this platform maybe Christian or other religion. But what's your perspective in terms of spiritual components
Okay.
of holistic health, knowing that fully well you have ventured into um, various aspects of medicine and honing it now to maybe the medical spa and the likes. So that's one. The second one, actually, with respect to the issue of BP, although Dr. Ezigu has mentioned it, is on the issue of the the stress, because the stress related to the stress that is actually, we have more stress in these days than how it's used than it's the way it used to be. So what's your, because this the day and age, we're having information here and there, and it's like this thing is not surmountable. What is it? What can we do? Thank you very much.
Okay. Thank you.
Thank you, Dr. Adewale. Thank you. Go ahead, Dr. Warren.
Okay. All right. Thank you so much, Dr. Adewale. I'm going to take the first one, and I'm glad you said from my perspective, because as a scientist, I'm also a believer, but I believe that the two should be blended. So when I was growing up, and I give you an example, when I was growing up, my parents believe that because they pray for us, because they believe that nothing can touch us, that nobody, because I came from a polygamous house, that nobody can touch us if we believe that, if we don't eat from what they give us, if we don't eat poison. Do you understand? So, like, no matter what they do, that is just them. So it has to be a belief. So, and that is why when you pray and say, okay, you have blood pressure, you have all this disease, and you're praying, you're believing that something is going to happen. But unless you take yourself to go somewhere and do the work, not eat the food, that the poison that somebody else has given you, you may still die from that disease. And God can still punish you and say, can still tell you, why did you not listen to me? I provided you a doctor. I provided you a pharmacist to give you all that. I provided you a hospital. Why didn't you take yourself there? Do you understand? That's the way I see the blend of spirituality and medicine, because it's God that gives us the knowledge to do those things. So, and I, as a patient, need to take the responsibility of praying for myself, having a peace of mind, and sleeping well, and making sure I'm doing what I need to do for myself, and also seek professional help to guide me to provide the need that I want. So the other thing about stress that is more common in this day and age is, despite the fact that it's more stress, the age, the age of death age, what do you call that one? What was I trying to say? The life expectancy rate has risen. Do you understand? There are more stress, but people are taking accountability and doing what's necessary to take care of things. And you have to individually examine what you're surrounding. What are you holding on to that is creating that stress? What is in your environment that is creating that stress? What are you exposed to that is creating that stress? Is it family related? Is it work related? Can you do without the stress? Do you have alternative? Because in life, when one door closes, another one is always waiting aside to open, if you open your mind to see. So we should always look for alternative. And when you think within yourself, if you have the mindset that no matter what happens today, I will have an alternative to take care of things. That reduces your cortisol level, that reduces how you handle that situation, and that reduces the effect it has on your body. And that is what they call the mindset, so in terms of how you focus on things. Then, and if you're prayerful, you can pray and say, thank you, Lord, for answering my prayer. Because I remember one story my daughter told me, because I used to worry a lot, just like we did now. I'm okay now. I used to worry a lot. And then she just came in. I was in my study. She just came in one day and said, Mom, why do you worry so much? I thought you believe in your prayers. So if you already prayed, everything is going to be okay. So, but if it's not okay, then that is what is meant to be. Do you understand? So, and I think that's how we can reduce stress in our life, because what we cannot take care of today, leave it for tomorrow. That will be other opportunities. Talk to a counselor, talk to someone. It may be just the mental health state that you need to focus on. Find a relaxing moment, hydrate yourself, make sure you get enough sleep, and talk to a trusted member.
Thank you so much for that depth. And thank you for being somebody who lives by example, because you just lived it before us. There were over 20 of us on here when you got a call just before this Medical Mondays with .co, just before you started presenting. And it was your daughter in New York, in a building right now with a gunman in the building. She called. You excused yourself, took the call, said she's on second floor, and you said, but let's do this. She's in God's hands. You lived it before us, trusting God and alleviating stress. Thank you. And by God's grace, she will be fine.
And to God's grace, she's fine. So because they were just showing it on CNN. So the two men, the police, they were able to get them. One killed himself, and they got the other one. They killed one. So
as we are doing this program right now.
Yes. So all is well. So she says she's okay. I just got her text.
Praise God.
So,
You lived
thank
it.
God. Yes.
So, Dr. Okpeyemi Adewale.
Yes, ma.
Did she answer your question?
Yeah,
and did she just leave it before us? This is her daughter, our only child.
Wow.
She's in Maryland, her daughter is in New York. She's not in the state where she is.
Wow, that's a great testimony. That's a great testimony. We thank God for that.
She did not stress out. We did pray really quickly and
yes, we did.
started the program.
Well,
so
yes.
If we say we are Christians, we trust Christ, we should live it. We should really trust him, because he is able to do all things as we ask. That's what she has shown us tonight. I cannot thank you enough. Thank you. You increase my faith.
Wow.
All right.
Dr. Payemi, you want to say something?
Yes, thank you very much. The another perspective that we also want to look at because with respect to being spiritual, of course, everybody believe that we believe in God, that there is as a most superior being that we can see. As Christians, I believe that the Word of God has shown us so much, especially with respect to how we can relate with God, cast all our cares onto God, how we can pray to God and believe that He is going to hear us. And more importantly, in these days where people lose their identity, we have our identity in Christ. And I want to believe that's where it actually starts from. Because when our identity is clear, when we understand what our identity is all about, we can move from there, and it's going to help us to manage our other things. It doesn't mean that somebody will say, okay, I'm a Christian, you are not taking care of your physical health, you are not a mental. No. But the roots, I really appreciate the fact that she mentioned that concept, because I don't really see much people talking more about it, even living that example, as you have just in our own way, as we have just seen. So is our identity in Christ made all the difference, and allow other things, to fall in place. Some things we may have to use, we have to use drug, we have to do consultation, we have to do meditation, we have to, all these things we just align. So that's just my own contribution as far as that controversial issue of spiritual component is concerned. Thank you for the opportunity. Thank you.
Thank you. Dr. V, kindly unmute.
Okay. Am I unmuted now? Okay,
Yes,
great.
you are.
Good evening, Dr. O, and our great presenter and everybody. This is food for the soul and the body. Thank you. So I want to thank our presenter for being courageous, because it takes courage to stand up fully and speak power to the truth. And I heard Dr. O say, I learned from it. I learned from it as well, because I just thought of courage. And then Dr. Kweyemi added his own position. And I just want to thank you for your presentation tonight, and a reminder of how we need to take care of our health. I think that everything you said is what I'm definitely trying to practice, and pipeline Dr. O's knowledge, which she's given me a lot to help me with my health conditions, to the point that my vitals are right where they ought to be. But we don't do it without a faith in God and piping down all the resources around us. It's God's way of blessing us. And really, you're so right about putting your total confidence in God, because things happen and you don't want to say, God, why me? Or God, where are you? You just want to go back to the prayers, and it works. So testimony to everything you've said today, that it's for me, that's what works. Thank you, Doctor. We appreciate you. Dr. O again, you always hit home run. Thank you.
Thank you. It's God.
Thank you for the platform privilege to speak.
Thank you. Thank you so much. Madam VP, our CEO.
CEO, I haven't heard. I heard. I was going to say I didn't hear from you.
She's speaking now.
Incredible. I echo what Dr. V said, our great presenter. Thank you. And for balancing it, I just wanted to add to what Dr. Okpeyemi said, because faith is about action. So you trust in God, but you still must take that action. You go to the doctor, have yourself checked out, believing that whatever they pronounce, that you're going to overcome it, because the Bible says we overcome by the testimony of our mouth and by the blood. So don't come out of the doctor's office and say, oh, I have this, I have that. No, you don't. The symptoms are there, but you're going to do what the doctor tells you to do, because you're going to overcome it. And you need to surround yourself also with people that you can count on. Thank you.
Thank you so much. And when next you come to Maryland, you're going to Dr. Ogunrinde for your massage.
Yeah. My body wrap. Hey.
For the body wrap, for the body heat.
You're all welcome.
And guess what? I heard something she said. You get a discount, everybody, when you mention Dr. O.
Yeah, yeah.
You came from Medical Mondays with Dr. O, just say Dr. O, and you get a discount. I heard it and I saw it in her presentation.
You saw it in writing.
I'm
Yes,
coming for my body wrap. Oh, yeah. Hey.
So when you have two Dr. O's, then the two
Dr.
Dr.
Izogu,
O's,
don't
you
get
get
on my case. You don't have an office in Abeokuta. Do not get on my case. You only
I'll go back. Okay, God bless you.
You know what? Dr. Izugu and I have been working on the HTPDC in Abeokuta.
Oh,
Yes,
awesome.
we have been. I told him, I said, the next stop is Abeokuta. But we did
That's
the
right.
True. Yes.
Thank you, sir.
So,
Amen. Thank you.
Dr. Lola, the blood pressure chart has been posted in the chat box. I hope you see it. So, Sister Flo asked the question, what causes tinea vesicular? How can it be effectively treated?
Okay. Well, tinea vesicular is almost like an autoimmune kind of skin lightening. So, and it's it also could be fungal kind of mixture together kind of thing. So usually when we treat this, I usually use Lotrison to treat it. So because it has a little bit of tenacious on it, and then you can use the cortisone part of it helps with the fungal aspect of it. And it's sometimes more common in the musty area, like your back and all that. So, but it could happen anywhere on the skin.
Fantastic. So, Dr. Lola, on mute.
Yes, thank you. Thank you for this presentation. I'm not sure if what I'm going to say is going to bless somebody. This is what I do. When I'm going to my doctor, I start praying the night before and even in the morning that the Lord should touch my doctor to do the right thing, to use him or her and give her the knowledge to discover exactly what needs to be done regarding me and my family. There's one that I'm going through right now. When I went to see my dentist, unfortunately, I didn't pray. I've been going back over and over again for the same thing. So I just want to put that out there in case somebody might be blessed.
Thank you. Thank you so much for sharing. And you also asked old age skin patches mentioned by Sister Tower is also hereditary, you said. Pharmacy school, they did do that.
Sister Miriam, okay. No, because I'm having the same thing, and I know my mom has it.
No, I'm
my
kidding.
uncle had the same thing.
No,
So.
it can be a hereditary. You're right. I was just teasing you as usual.
Thank you.
Thank you.
You degree yẹn ti pọ̀ jù, Aunty Tawa, degree yẹn ti pọ̀ jù.
I know, Aunty Tawa. So, Sister Matilda said something about the blackened knees. Blackened knees and elbows are oftentimes formed due to frequent rubbing over surfaces and friction, she wrote. She said this builds up dead skin and calluses. It can be gently removed with microdermabrasion to exfoliate and intentional regular use of a moisturizer. Natural scrub like sugar or oats or roughly ground rice is also very useful to exfoliate, she says. Be sure to apply a gold moisturizer. So, Dr. Ogunrinde, what do you say to that? Do you do all of those?
Yeah, so we do like the area, because of the friction, it causes the thickness, like the skin is actually very thick. So because of the dead skin there, so you have to do various, we do chemical peels around there. So, but what's, I was only giving the natural aspect of it. Like if you wanted to you could do turmeric peel, but anything that causes, deep moisturization or even filing around the area, scrubbing it will help to reduce that. But at night, sometimes if you kind of, in the evening, you can put a little bit of like, like how people wear like arm socks, you can moisturize it and put a little bit of deep Vaseline on it after you have, kind of exfoliated the area. But, if you want medical treatment, that is more of deep exfoliation in the office. So, which is also treatable as well.
Fantastic.
Mm-hmm.
Dr. Alu says, what causes pimple on the face of children? Perfect person to ask. She's a pediatrician first. No. OBGYN first, then pediatrician, and everything else that goes on. So, what causes
It depends
pimple?
on the age. Which age are we talking about? Like, the hormonal changes starts from the teenage year. So, and that would be like the pores, when the pores are kind of a little bit blocked, and you have like mild bacterium, in, kind of, getting into to the pores. So, and then it may form that little pores. So, and the more the pores, usually it's just like a little flat redness area, but as the pores tend to come to the surface, it gets exposed to oxygen, the color changes from white to blackhead and all that. So, and so depending on the stage that you see the pimple, um, the most important thing is just to know which age group are we talking about. If it's more hormonal, there are different ways of, kind of keeping the skin clean using mild, non-irritating moisturized soap cleanser, and also kind of keeping the pores tight using toner is fine. But there are other, what we do in my spa is we use the blue light therapy for acne treatment, which kills the bacteria within the acne area. But usually we use that for the teenagers, like I said. Exfoliation is good. When you think of little children don't have pimples like, like the pimples that you expect in like teenagers. They may have few spots on on few spots on the forehead when their pores are clogged, because we all lubricate them with this thick oil and all that. And they do have, when they have growth spots, they may have a bounce of little bit of hormones that make them a little bit sweaty more. So they may have pimples once in a while, but that's not something you want to go into major thing about. You just need to keep their skin clean, use very mild moisturizer, nothing too oily on the face. That's for the little ones. If you're talking about newborns, in the first, baby acne is different. So that's the one you guys are passing on to the baby. So that's the hormones left over in them that causes all that little baby acne on the face. And usually you just keep the face clean, not too much oily, because we do ori and all that and lotion them when they are born, but that's the time you need to not overheat them, not to overdress them, and not to over oil them around that age when they're having the seborrheic dermatitis, where you have a lot of acne on the face because of the hormonal thing coming into them. So those are different age group kind of thing.
Thank you so much for that in-depth education on acne. It's always a problem. Sister Bumi Daramaja says, thank you, Dr. Ogunrinde. That was very well addressed. In fact, everything you've said has been very well addressed. What we have no control over, we leave to God to take care of. That's a big stress relief, and that's on point. Thank you. Many thank yous in the chat box. I'm just going to quickly read them. Praise God Almighty. Thanks a lot, Dr. Teju Ogunrinde, for all you shared. Thank you, Dr. T. Ogunrinde. That was a great testimony. And she said she's missed medical Mondays in a while. She's back. Thank you. Dr. Teju, informative and insightful. Dr. Ogunrinde, why is dandruff difficult to treat? And what can one do to get rid of dandruff?
Okay.
Also, what can one do about nail fungus?
Okay.
So 2 questions.
Those are 2 different questions. Definitely.
Yeah, nail fungus. Okay.
Yeah, so the hair, the dry hair, the dry scalp, that it depends on what's causing the dry scalp. You know, there are various, if it's just scaly, because you can have eczema of the scalp, eczema of the skin. If you have eczema of the scalp, you need to, like, the way to treat that is to try and not do tight braids. You need to relax the tension on the scalp so it's not irritating the scalp. You need to oil it regularly and use something like a mint oil and all that. Very rarely we use steroids, like topical steroids on the scalp to reduce the inflammatory process, but you don't want to use the steroids for too long because you lose the hair along the line. So, and psoriasis is another one, but usually, that's a rule. You have to rule out other stuff when you're talking about psoriasis. Are there other components like nail involvement and other skin involvement when you're talking about psoriasis? But usually, dandruff on the scalp is usually dry scalp, very dry scalp, and irritative processing of the hair. Some people are allergic to sulfur. So if you use sulfur 8 and there's something like that, you're going to have reactive process on your hair and it's going to be very itchy. So like how you first do braids and you use all these things and 2 days later you're scratching and digging into the scalp. You're irritating the scalp, and when the scalp heals, it's going to form scales on it. So we want to reduce that. To reduce, you can do loose little braids, not the tight ones. Then the other choice is what you think is dandruff may also be fungus. The same kind of yeast that kind of infect that kind of like, go on the skin, like in the pityriasis versicolor kind of thing. They may also be in the scalp. It's not typically the ringworm, the one that people usually say ringworm. Those are usually discrete, they are localized, and they have hair loss in the middle kind of thing. You will have hair loss, accompany that one. But if your hair is all over and it's all scaly, it's good to use Calcium Blue shampoo. That's a good one. You can soak it into your hair, let it stay there for about 30 minutes before you wash it off. And then you can lubricate the hair after you wash it off. Ketoconazole shampoo is also good, just in case there is secondary fungal infection there. So those are when just using shampoo as ketoconazole may help. If you really have ringworm, you have to take something by mouth. But topical shampoos can be good for like dandruff that just have, that you're just taking care of secondary fungal inoculations around it.
Fantastic. So Dr. Ogunleye from California says spraying rose water on the scalp and hair also helps with dry scalp. So
What?
rose water.
I mean, any moisture, I think any moisture, right? If you put rose water, like regular rose water, you buy rose water, put a couple of drops of peppermint oil into it. It's fantastic. You can use it to spray your hair
Peppermint
and
oil.
circulate it. I think it's a good idea.
You said peppermint oil? Put
Peppermint oil, yes.
In it. So she said most hair shampoo and conditioners are made for whitey people. Who are whitey people? Who produce excess oils in their scalp. Dr. Gulaye, kindly unmute and speak.
Explain yourself.
Caucasian whitey people.
She says, we don't. Therefore, we shouldn't be using the same products. Okay. Dr. Oyudim helped me. She said whitey is white. I learn every day. That's a new vocab now. I have to ask my
That's social media
vocabulary.
vocabulary, ma'am.
You see, that's Dr. Gulaye. Oh, yeah, speak.
Social media. Social media vocabulary. Because sometimes when you use colors, you get flagged. They think you're being racist or whatever. So people started using just BLK or BL and YT for white. Yeah, so
As you already know, I make hair and skin products. So I've discovered that using certain shampoos and conditioners that is meant for them is not necessarily good for us. They produce excess oil. We need the oil. So when we're using the same product, we're working against ourselves. So that's why I put that in there.
Thank you. And you've seen that rose water.
Yeah, I use rose water on my hair every day.
And
I
I know
just
your
spray
hair.
it.
Yeah,
And, I have really long hair, although it's locked, but it's really long.
I know. Very healthy.
Yeah, thank
Thank
you.
you. Thank you for sharing. Dr. Udim, I saw you, and I'm waiting for my suya.
It's on the way.
Dr. Ogunrinde, she makes
Yeah.
the best suya.
Oh, wow.
And I just ordered.
Okay.
So if you go to
In
obalindesuya.com.
Maryland? Oh, is it Maryland?
No, she's in California. She milk,
Oh.
they ship it like overnight. It
Oh.
comes fresh, frozen, and well, with all the ice packed, not frozen, but
Okay.
ice packed and everything that is fresh.
Okay.
And obalindesuya.com, I think, online. That's where you go, you order it.
Obalende Foods. We do
Obalinde,
more than suya.
it's Obalinde Foods, right?
Yes.
Okay. Online. So I just saw that I'm waiting. My mouth is watering already. Ah. When I see those pictures. Dr. Udim, kindly unmute. I saw you.
Hello.
Hello. Yes.
Astiere.
So were you going to say something?
No,
Oh, you were going
just
to
wanted to say hi.
Thank you.
Yeah, you're welcome. So
I know you got my back. Thank you. Fantastic. Thank you so much, Dr. Guride. This has been amazing. But before you give us your closing remarks, what we need to remember to take home, we have a young daughter of ours. Esther, are you on? She's, are you on? Esther?
I am. Hello.
Okay, we can't see you.
No
Can you
worries.
show your face? She's actually competing. Do you see her? Beautiful, natural. Dr. Guri, they would like this.
Let me see her. Where is she?
Hello. I think I have my camera on.
Okay, yes, I see you now. Yes, I see you.
And I
So,
think I'll flip over to my iPad real quick as well.
okay. So she's doing something special and I heard about it. So I reached out to her through her mother that she should come on Medical Mondays tonight because of the topic you're discussing. That she should share with us what she wants to do. She's participating in a pageant and needs to raise $1,000 that has to come from different people. Like one person cannot give her 1,000. She has to raise it from everywhere. I said, come on Medical Mondays. Come show us what you want to do and see who will support. So you can raise the $1,000 and go win for us. So what are you running for, Esther?
Hello, guys. My name is Salimata Sanfo. I'm running for Miss Maryland, USA. I got chosen as a finalist a few weeks ago, one of the top 30 girls in the state to compete for the title. And the winner of Miss Maryland goes to Miss USA automatically. So the ultimate goal is Miss America, like the real Miss America, as crazy as it is. And I'm just going to use my platform to advocate for different changes. I have a small PowerPoint that I made. I'm going to show you guys real quick. If I could share my screen real quick.
Oh, I don't think you'll be able to. I have to help you with that. There you go.
Oh, thank you so much.
You're welcome.
There we go. Can you guys see?
Yes.
Amazing. I just made a quick blurb of who I am and where I came from so people can know who they're supporting. I'm from Alexandria, but I grew up in Maryland. You know, being West African, you come to Maryland for everything, church, school, you know, family things. So I spend a lot of time just, you know, crossing the bridges everyone else does. I went to school in South PA instead of doing organizing there. I was a government major on the pre-law track, and my focus is on community advocacy. So all of my work in undergrad and after undergrad, I was a nonprofit consultant. So I raised money for various nonprofits and did work around racial and economic equity. After that, I started modeling for a bit. God opened a crazy door. I posted a picture on Instagram, and a very big designer saw it and called me in. So I was modeling and going to school, and then I went to get my master's degree in nonprofit admin. My current plan is to go to law school, get my law degree, finish my education, and keep working in this realm. And when I become Miss Maryland, speaking positively, my goal is to empower young women to both chase their dreams and help others. I think in the world of social media, it's very easy to become very, not in a bad way, but, you know, very self-focused. And you can forget that God calls us to help others as well. The calling of Christ in our lives is to, yes, build our goals, you know, hit every milestone you want to hit, but also to take care of the community. And a big focus of what has grown me as a person the most in my experience has been my community. Having, you know, especially being from Maryland, having so many incredible African leaders around me to guide me and show me the power that we have is what really pushed me towards a lot of my goals. So my focus would be to go to the schools in the area and teach young girls the same thing. You can, you know, be pretty, do the lip gloss, do all of it and still go to school, still be educated, still go out there and commit your goals and help your community in the small, in ways that are both small and big, because it all starts out with the small things. So this is just who I am as a person, so you guys can know what's going on. I'm very excited. It's been an incredible journey, and I'm very grateful to Dr. O for allowing me to speak on this platform. Here's also my information for support. I have my Venmo, my Cash App, and my Zelle. I'll put them in the chat as well. And if you have any questions, feel free to let me know. I'm moving fast because I know you guys have been on this call for a while and it's getting late. People have things to do, and I appreciate all of your time.
Wow. Thank you so much. Thank you. And thank you for agreeing to come showcase you, because we, as your mothers and the fathers on the platform, we're proud of you, what you have achieved so far. And I can't wait for you to graduate from law school so we can come celebrate you also and celebrate this win. So just 10 people vouching $100 will achieve the $1,000. Sister Eva Ross, that's my sis, said, yes, beautiful, I am supporting. She's supporting you already. Please put those, you know, Zelle and everything in the chat box so that we can have it. Thank you so much. And thank you for putting us out there in beautiful ways. Thank you.
Thank you guys as well for your support. It's been very exciting. I feel like growing up, I never got to see, like, you know, African women doing things like this. So it's exciting to be a part of like the first wave of this push. And I'm sure there'll be many, many, many after me, and it'll be an amazing experience.
Amen to that. Thank you. Thank you. So, Dr. Teju Ogunrinde, the ball is back in your court, you know, so please give us your final encouragement statement, and we have your contact. I'm coming. Hey, I'm coming to get my Medical Mondays with Dr. O discount.
Yes. Yeah, so I'm really glad that I was able to join you today, and I really appreciate everyone listening in and contributing their parts to it. So my contact is there. So if you need to reach out to me, you can email me directly so I can facilitate if I can help virtually at any time. So like you said, I do have products, and we'll have Elevate Day. I'm going to send, because we may have an Elevate Day, which is like a demo day. So where people can have free feel of how the medical spa kind of feel, So I'll let you guys know when we do have that. So in other times, I want you guys to take this moment, just get yourself a gift of the blood pressure machine if you don't have one. I think everybody should have one. And just to make sure we continue to live healthy, have a good mindset, be hopeful, and be truth to yourself, and know that all is going to be okay. Thank you again for allowing me to join you. And I want to wish Salimata good luck in your journey. I know you'll do well. You're very pretty. So please, Dr. O, if you don't mind to send the Zelle link and all that to the WhatsApp after the program, that may be helpful for some of us to be able to do it after the program.
Thank you so much.
Right.
I'll do that.
Thank you so much, and I wish
but
you all the best.
somebody is getting us, so but we should please address how to treat nail fungus.
Oh, yes. I'm so sorry. I forgot that. So I think we were talking about other things. So yes, nail fungus. It's nail fungus should be combined with topical application. It's a deep fungus, so that needs to be treated orally. Is one of the most difficult fungus to treat. You need to allow the nail to grow out so that as they grow out, you can file it. That would be topical medicine, but you have to take medicine by mouth for it to heal. It's almost like, the nail for the head and the one for the nails, those need to be taken. You need to take medicine by mouth. If you are doing topical one, it usually doesn't help much. Sometimes for the ones on the feet, you need to expose it to air. If you are wearing shoes and all that are covered, you need to make sure you expose it to air. Bleach is always good. So if you soak it in bleach soak, like you put a cup of bleach in like warm water at night, you can always do that. If you do wear socks, you need to use white socks, so you can, especially for men, you need to wear white socks so you can bleach them, so you're not infecting yourself. For women, if you do nails, like you go to the salon and you do nails, you should take a break from that, because sometimes that's the commonest place where you get nail fungus. You see the changes, you first see that under the nail bed, you see the yellowish green change under the nail bed. You should stop. There is moisture under your nail, artificial nail that you put in. You need to just take a break and take it out, because the longer there is moisture in between the artificial nail and your nail, the fungus will grow. And if it gets below your nail bed, it's going to be more difficult to treat. So like I said, they have topical, medicine that you can put, antifungal topical medicine, like a drop that will be put in as liquid, and then you have to take medicine orally as well.
On point.
Okay.
100%.
Okay.
Nail fungus is interesting. Most over-the-counter medications don't get rid of it, usually. So thank you. I think all the questions have been answered. And Dr. Ogunrinde, thank you so much. But you're going to give me extra discount because you had this special thing going on. My sister Lola came to your clinic. I just heard
That's why I mentioned it again.
No, you know what? She didn't mention it. She did not
Okay.
mention it. She just said she came to you and was like, oh, she came for a spa day and all what, But when you were presenting, you now said you had a special event. You didn't tell me about it.
I'm so sorry. I didn't think you would drive all the way. So, but then Lola came. So, but then when she was there, she said, you know what? I should have invited Dr. O to come. But yeah, I was sending out the information, and I figured, people that responded, that registered, were the one that we did the demo for. But it was also encouraged to bring a friend. So that way, if we have more space, we could have done some of those other people too. But don't worry, you'll have a special invitation for the next one that we do. Okay.
I'll look forward to that. Okay. And thank you so much, everyone. Till we meet again next week, please.